get a little bit more about that with Labour's Shadow Attorney General, Emily Thornberry, who joins me now. Good to see you this morning. Thanks for coming in. So the Home Office has announced these new plans to ensure that police officers are properly vetted and to strengthen police dismissals. Does Labour welcome this legislation?
Oh, yeah, of course we do. I mean, we have been asking the government to do this for some time, and I do wonder sometimes why they take so long. It's like they wait until the last minute and they get dragged, kicking and screaming into doing half what they ought to be doing. We do think, of course we welcome it. We just wish they'd done it earlier, and we suspect that it may not be enough.
What would Labour do more? How much further would you go then?
Well, for example, we think that one of the fundamental problems with the police at the moment, and the lack of trust that particularly women have in relation to the police, is that they don't take violence against women sufficiently seriously, and that includes domestic violence. We don't think, but they have a history of not taking domestic violence sufficiently seriously, and police officers themselves can be accused of domestic violence, and yet they're not suspended. They continue to be in practice. We've seen some of the most shocking cases have been people who have had a history of domestic violence. The police have known about it, and yet they've continued to be allowed to be out on the street. So we would say that if you have been accused of that, you ought to be suspended, and that should be something which should be taken seriously. I mean, it absolutely should be taken seriously, because potentially that shows a disturbing attitude towards women that is completely inappropriate for somebody who's supposed to be protecting the public to have.
I mean, is it possible to measure the success of these kind of measures? If Labour were to bring something in, how would we measure whether it had worked?
Well, I mean, our biggest measure is that we want to halve violence against women and girls. And we want to do that by increasing the number of police officers, but making sure that the police officers who are coming into the force are properly vetted before they even get in. There's two things. There's vetting them when they come in, and then once they're in, making sure that if they have behaved in a way which is inappropriate, that they're out, and they're out as soon as possible. So we need to do both of those things. But we've got a number of other things that we want to be able to do in order to change the culture within the police. And one of those is to make sure that every police force has a particular unit whose responsibility is violence against women and girls and rape. So, in order to, because at the moment they don't even have that. I mean, it's extraordinary.
Some forces have,
And they've been getting rid of them, and they used to be much more. I mean, when we were in power, we had these units in all police forces, but they've slowly been withering on the vine, and we would definitely introduce those again, not just because of the very work they do, but also because it helps to, I think it helps to push the change in culture when you have people whose priority is, and who understand, have a deep understanding of the forces behind of why it is that there's such an increase in women and girls. And the other thing all I would say is, not only do we have a great increase in these offences, but also, of course, even more worryingly, we have so few of them being taken up and so few of them being prosecuted. As you know, I think it's 1.6% of reported rape cases actually end up being charged. Okay.
What about vetting? Would Labour do anything to change the way that those coming into the force are vetted?
Absolutely. So, I mean, for example, there are a number of changes we want, but one of them is, during the pandemic, understandably, police officers started being recruited online, because you couldn't have the face-to-face interviews. And some forces still have, as a practice, they still are recruiting people online. Now, I think that's completely wrong. I think you need to be able to sit down and look a senior police officer in the eye and explain why it is that you should be trusted with protecting the police. I mean, I do think that's really important. And I have to say, I mean, I've written and asked how many forces are still doing online recruitment, and ministers can't even tell me, because they're not collecting that sort of data. And that, I think, says a really important truth, which is that I think ministers are getting increasingly complacent, and it's one of the reasons why they're not able to drive change, because they're just trying to kind of, put sticking plasters on problems, and these sticking plasters aren't even sticking. I think it's a comprehensive problem throughout departments, but I think in justice, and I think in the Home Office, I think we see it particularly badly, that they just want to strike a pose, they want to be able to have a good press release, but when you dig underneath it, they don't really know. They don't really have the data, they don't really prioritise it, and so they're not able to say, this is how bad the problem is and this is where we expect to get to. And your I mean, your work on upskirting, I think, absolutely shows this. You know, the fact that you had to ask all those freedom of information requests in order to be able to get the information, which is so shocking and the public does need to know. Now, if I'd asked those questions in Parliament, I would have been told that that data wasn't available. And you had to have freedom of information requests to all the different police officers. Why doesn't the Home Office collect that information on a new offence so that they know whether or not that new offence is actually, that new law is working or not? They wouldn't even have had that information if it hadn't been for the good work that you guys have done.
What do you make of the results of it? Only 68 convictions and 40% of those affected children.
It's just horrible. I mean, it's just horrible. I mean, as a mother of kids myself, I mean, just the idea that you could have taken a child on an underground and a photograph like that to be taken, and I mean, you have the evidence and you go to the police and the person's not even prosecuted. It can be devastating. Devastating for a mother who wants to protect her child, devastating for the child. And what attitude will you end up having in relation to the police force if you think that they aren't even prepared to prioritise something like this? I mean, it is a disgusting crime and it needs to be taken seriously, and it isn't enough to just pass the law and say, oh, well, there we are, we fixed that. You have to have the follow-through and you need to be able to supervise it and make sure that police officers and police forces are doing the right thing. And that is a responsibility of ministers to make sure that that is happening. And clearly they're not doing it.
Do you think victims are being let down by the current system?
Well, yeah, what do you think? I mean, of course they are. Of course they are. I think women are being let down by it. I think, women are being let down by it because, again, it says to women, you're not actually as important as you think you are.
The reason that we've got you in today is that Labour are talking about waiting times. 120,000 people died last year while waiting for care on the NHS. This was something that was unveiled by yourself through your research. The figures are higher last year than they were during the pandemic. Yes. It's not a simple tackle to address this, is it? If Labour were to get into power at the next government, where would you start?
Yeah, I mean, so first of all, we need to start by being honest about just how bad the problem is. So waiting lists are higher than they ever have been. 60% of people who die are on waiting lists and they haven't even been seen, and then they die. So this is how bad it is. And it exposes just what has happened to the NHS during the 13 years of Conservative government. It wasn't like this when we were in power. And look what's happened. So there are a number of fundamental things that need to be done. We've talked for a long time about the need for having more doctors and nurses, and we have not only said the number that we would have, we've also said how it will be paid for. We would close this loophole that there is that allows non-DOMs to not pay tax in the way that Rishi Sunak's wife wasn't paying tax at one stage. We would close that loophole and
she didn't do anything illegal. We must.
She didn't do anything illegal. The thing about loopholes is that they're legal, and what you have to do is you have to close them. So we would close that loophole and we would stop people who live in this country not paying tax, and we would use that money to train doctors and nurses. Now the Conservatives again, have limply along, behind us have said, oh, we're going to have more doctors and nurses too, and we say great. And how will you pay for that if you're serious? What's your... And they've yet to tell us how that's going to be paid for. But there are a number of other things. You need to do much more work to make sure that people can live healthier longer. So we need to make sure that we have more care for people in their homes, which keeps them out of hospital. But also we need to make sure that we live healthier lifestyles, so that we make sure that there isn't there's a whole range of different things. Whether it's advertising junk food, whether it's making sure that you have mental health support within schools, making sure that you prioritise mental health. Those sorts of things are all things that impact on people's health per se. So we have all, and we would also not be scared about using the private sector if we need to. If there's surplus capacity within the private sector and there isn't enough space in the NHS, we would say, if you need to get your hip replaced, we will send you to a private hospital to have that done. Because it doesn't matter in the end. If you need your hip replaced, you need it replaced.
Yeah. We're going to leave it there. Emily Thornberry, good to talk to you. Thank you very much for coming in.
Nice to talk to you too.